I was invited because I belong to the European Society of Surgical Oncology, and we are really glad that we are starting new pathways of collaboration with ECC. It's a wonderful meeting. It's my first meeting here in St. Gallen, and it's outstanding. I mean, the level of the speakers and the quality of the talks and the quality of the live surgery this morning. The setting looks like professional cinema, and it's wonderful. So I really think we surgeons need to socialize. We really need to engage together to talk about projects, to see how other colleagues do in their clinical practice, to can evolve and to can learn. So this is wonderful. It's an outstanding initiative, and I'm very glad to be here. I think it's of the utmost importance because we really need to find out what our colleagues are doing in other countries so we can grab new ideas and implement other ideas in our country. I found very interesting to see how other colleagues are doing with some technologies. Like, for example, there was a symposium on the AlpiTube, which is something to avoid ileostomy for patients with fat-root cancer, rectal cancer. I haven't heard about that before. That really shocked me, and that was wonderful. And that was a wonderful idea that I really want to implement now in my institution. So I think it's always a very good idea to grab ideas. I was recording a video for my endoscopists because they were talking about one device to treat fistula in the pouch or complex fistula that are not big enough for the sponge, and they were talking about one new inner device, and I was recording the video and sending that to my team. So I think it's wonderful always to open your mind to new ideas. We do need the industry, and I was talking to somebody about how wonderful this way of distributing the exhibitors are, because it really helps to engage and to talk to them. I really like that the food is in the middle of the industry because it gives everyone the possibility to engage more and to ask. And I really like that all the stands are really open so you can really approach everyone, and I love it. I think it's essential. We do need technology to improve our abilities as surgeons and to give better outcomes to our patients. And sometimes it's awful when you feel a little disconnected with the industry. So we are, even in our conferences, we are trying to do the same, to involve industry even during the talks, because we need interaction in between surgeons. They need to understand what we need and what our patients need, and we need to understand what they are capable to reach. I think one of the best it's always difficult to give advices to other people because all of us, we are different, but one of my mentors, he is an outstanding surgeon yet still. He always, not with words but with his example, he taught me about 3 things which are very important for surgeons. One is to work hard because we have a very high responsibility and we devote a lot to our patients. The other is to give back, to be extremely generous with the juniors, to train the juniors and to involve them in ideas, projects, to let them grow around you. And the other is to have fun, because our work is very emotionally draining and energy draining. So we really need to have a very fulfilling life outside the operating room. So work hard, give back, and have fun. I think surgery, when I was a student, and then I went for the first time into an operating room. Well, the first time I fainted, but yeah, there was a rhinoplasty and that was awful to me. But the third time I said, wow, I was flashed. I thought, wow, that's wonderful. That's my pathway. I had never ever imagined that a job could be so grateful, so fulfilling, so rewarding. It's true that surgery is a passion to me. Maybe what I'm the most proud of, I think, the capability to engage with patients over the years, to develop this way and this ability to love everyone, because sometimes patients, beyond our technical skills, our trials, our devotion to them, our ability in the operating room, I think over the years I have learned not only to treat patients but to love patients and families, and I think this is a very good accomplishment. I have Of course, in my CV, plenty of things that I am really grateful for: belonging to societies, organizing conferences, um, being involved in very important trials. But I think at the end of the day, the thing you feel the most proud of is when one patient gets into your clinic and hugs you and is really grateful. I think to be able to have developed this love to everyone.